Okay, patient safety culture surveys. So what? I know when you got the news that we're about to do yet another survey, this is probably what you looked like. Very excited, very optimistic, looking forward to that survey. It's probably also what your staff were thinking when they heard that there's another chance to take a step away from their busy jobs and engage in filling out question after question. Now, in all seriousness, in the coming weeks, we'll be administering the Patient Safety Culture Survey. Now, we know throughout the United States that the primary driver of preventable patient harm tends to be things like breakdowns in communication, teamwork, and situational leadership. It's critical for our patients that we identify these risks and address them on an ongoing basis. Now, to properly identify these risks within our units, our departments, we of course need to talk to the individuals that are closest to the patients, the front line. In safety science, we call this a sensitivity to operations. That is, to best identify these risks to our patients, we need to talk to the nurses, physicians, and frontline team members that are closest to the patients day after day. Now, fortunately for us as unit and department leaders, these concerns that our nurses and physicians and team members have are also the concerns that drive them crazy on a day to day basis. No one joined the medical profession to wait for minutes and possibly hours to get in touch with that critical person at the medical office or that physician to get that needed piece of information. So the same things that can cause our patients significant opportunity for risk are the things that are causing our team members to be disengaged. So as a leader, having quantifiable data about these perceptions our team have will help us to one, address them directly, and two, when needed, build a case to other leaders about what needs to change and what resources we may need to change. That's where the hospital survey on patient safety culture comes in. This tool has been used extensively throughout the globe, as well as being extensively studied on its connections to actual patient outcomes and risk of harm. It takes less than 10 minutes to complete, and this year we'll be using an external vendor that will ensure this survey is completely anonymous. There will be no way to track an individual's response back to their employee ID or email or anything of the sort. Finally, the feedback gathered through this instrument will be used to guide improvement goals, not just in the unit and department, but also as an organization as we look to improve patient safety culture. Let's talk briefly about the importance of response rates. So if each little figure here represents one of your team members, and we send the survey out to all, in this case, 18 of them, if we only get one response back, we better hope that this response comes from Happy Harry. Because if it comes from Happy Harry, everything's going to be looking good. But if it comes from Grumpy Gus, we're going to be looking pretty bad. Actually, the goal, or what we need to achieve to have statistically meaningful input and feedback from our team, is approximately 60%. With 60% of our staff responding to this survey, we're going to feel very confident that we have meaningful information that we can take action upon. Now, if we're not able to achieve 60%, a couple of things happen. First, we may not be able to provide unit-based reports. So when the data is analyzed and distributed, if your team doesn't have 60% or so, you're probably not going to receive a report on your unit or department. Of course, this makes action planning very difficult as there's not unit-based data to act upon. This causes a lot of frustration for the staff that did take their time to complete the survey. Although their response will be counted in the overall analysis, they won't be able to provide that specific input where the things can best be addressed in your unit and in your department. Finally, we may need to wait up to 2 years to have valid information about the culture of safety of your unit or department. And even when we have those results, we won't have a historical comparison. So if the results are good 2 years from now, we won't know if that means we've been improving for the past 2 years or if they were really good in the past and they've actually been declining. So without a good unit or department-based response rate, we'll have a lot of difficulty in improving safety culture and being able, to, of course, to use that information. So here's what we're asking of you today. First, please take this survey yourself. It's critical that we have the input from leaders like you, and that input will be guiding the executive team as we set targets and strategies for the upcoming year. Secondly, please remind, and re-remind your staff to take the survey. Stress that it's completely anonymous and that as the leader of your unit or department, you're eagerly looking forward to that feedback. In fact, beyond that, you'll be acting upon that feedback both within the unit as well as the organization as a whole. Of course, stress that this will take less than 10 minutes of their time, and most importantly, that we'll be identifying the major risks to our patient and also tackling some of those things that cause our staff so much frustration on a day-to-day basis. Best of luck to you, happy surveying, and I hope you get a great response rate for your unit or department.